Sorry. Good evening, everyone. I'm Dr. Aishwarya Sharma from Doctors AI, and today we are here with yet another episode of MedAI Webhour. So this is a initiative which we started at Doctors AI along with the collaboration of MedSynapse, where we meet every second Thursday of every month and we discuss the things that we like, medicine and AI. So today, this is one of the most anticipating sessions as we are going to discuss about data and doctors. It is one of the most pressing issues in the modern healthcare, I suppose, where data security, privacy, and AI is totally data driven. So, as the medical field is embracing the digital transformation and understanding how to safeguard the patient data while leveraging technology for better healthcare outcomes has become very crucial. So, so we have our esteemed panel of Dr. Umashankar Subramaniam, Dr. Taneja, and Dr. Supten, sir, who will take us through this journey of how, as doctors, we can navigate data and understand it better to use AI better. To moderate the whole session, we have with us Dr. Harsh. If you could, Hetvi, if you could please project the slide, Dr. Harsh CV. Okay, thank you. So, Dr. Harsh Hirani is MBBS and has done a 2-year clinical research fellowship in diabetology under Padma Shri Professor Dr. V. Mohan in Chennai, India. He is winner of Torrent Young Scholars Award and he is one of the best orator diabetologists, which we will get to know in a bit. He has completed masterclass trainings in diabetes and therapeutics and technology from USA. He is a gold level trainer certification from Time in Range Academy from US. He holds the advanced certification in AI in medicine from and MIT certification in no code AI and machine learning from Massachusetts, USA. He has a PG diploma in medical law, ethics, and policy making from National Law University, Gandhinagar, India. Such a diverse profile he has. I'm very glad to have Dr. Harsh on board to moderate this very crucial session of doctors and data. Dr. Harsh, over to you.
Thank you so much, Dr. Aishwarya, for the kind words of introduction. So, at the outset, I would like to acknowledge the MedSynapse team, MedAI webinar team, as well as Doctors AI team for this phenomenal initiative of knowledge sharing towards the latest nuances in the healthcare and digital space. Starting with few amazing things what we are happening right now in our country. We are at an intersection of healthcare transformation and digital innovation, and this intersection in 2025 has powered the healthcare system into a way which is no longer just an idea, it's into action. A lot of things we are seeing. So today, over more than 50 million, I repeat, 50 million teleconsultations are projected in India alone. That's where the whole space is growing, the digital ecosystem in the healthcare. And globally, more less than 40% countries have adequate healthcare specific AI regulations. And this is from a WHO report as old as 2023. And here in India, the landmark DPDP Act, which is Digital Personal Data Protection Act, underscores the significance of explicit patient consent, promising fines up to large sums, and so on and so forth. And cybersecurity remains again an acute concern, as we have seen a troubling number of more than 60% surge in ransomware attacks across the globe. And this is again from IBM X-Force report in 2024. So these points just underscore the need of such a session. And tonight we are privileged to have esteemed doyens of this industry. We have Dr. Umashankar, who is going to help us simplify understanding of digital Personal Data Protection Act. Dr. Taneja, he's going to help us about the cybersecurity landscape. And Dr. Supten is going to unravel the complex relationship between innovative AI solutions and the ethics and the patient care utilization of them. So, with this brief introduction, I would like to take up a formal introduction to the first speaker of the day, Dr. Umashankar. Can I request the team to please project the slide? The Honorary Secretary of the Telemedicine Society of India. He is also affiliated with National Association for Palliative Care and Integrated Medicine in Karnataka chapter. So he's managing director of Med.bot, Arogyati Private Limited. So this is again a futuristic technology driven initiative. So he's been in the industry for more than 22 years in clinical practice. He has designed and implemented multiple public health projects, especially into the field of HIV/AIDS, breast cancer, anemia, road traffic accidents, telehealthcare, and waste management. So, just adding to this, board of studies, he's been a board of studies member in several universities, including RGUHS, Kale University, Pravara University, Dayanand Sagar University, and many more. So, as an expert member, he has been developing curriculum for BHMS as well as MD, homeopathy, community medicine, National Commission for Homeopathy, and directly affiliating with Government of India. So, with this esteemed speaker with us today, let's take it forward. Let's take this session forward. Over to you, Dr. Umashankar. Thank you.
Thank you, Dr. Harsh, for that sweet introduction. At the outset, I would like to thank the organizers for inviting me to speak and share a few of my thoughts and something what I have understood little bit on this uh, data. So, can I share my screen? Yeah. Thank you. Good evening, all, once again. I know this is a new topic, and as Dr. Hush said, that it's also the most important on today's context. So, before I proceed further on understanding what is India's Digital Personal Health Data Protection Act 2023, let me put a question to all of you all. I'm sure all of us have filled in some kind of a form, maybe a medical form or some kind of form in our digital world today. It could be where we have shared our personal data. It could be our name, it could be our Aadhaar number, telephone number, bank account number, or medical history. All these things. And how many of us have even taken even thought about reading those terms and conditions, those lengthy terms and conditions which are written in very tiny letters, and all of us have just tick mark and then gone ahead. And today, this reading is even more important because today's healthcare, if we are talking about healthcare, we are going digital. Today we are all of us are using digital health records. There are online consultation, there are wearable health data devices, and most over new, what latest is we are using AI driven diagnostics, right? Well, all these things are bringing a lot of convenience and efficiency. One thing it also raises a lot of crucial, one important question is, how secure is all our data, especially the medical data, what we are talking about? What happens if it is misused, and who is responsible for all these things? This is what this particular act is going to tell us. It's giving us some kind of an answer, even if not the complete, but it is going to cater to most of these problems what we would face because of our digital personal data being available to all. Okay. So this Act, Digital Personal Data Protection Act 2023, as you all know, came in 2023 year, and it addresses all our growing concerns around the data privacy, data security, and with lot of services going digital, and it is all. We are going reliant, we are going dependent on the digital platforms, and as we are going dependent on these digital platforms, we need a robust data protection framework. And this is the most important what the government of India has done for us. And in today's session we will try to understand, we'll try to break up this act as simple as possible and see how this act is going to affect each one of us. I'm going to talk mostly in terms of the healthcare industry, be it patient, be it doctors, be it health technology, be it hospitals or something. This is what we'll be looking at. So, in the next 15 minutes, let me try to give you what are the salient features of this act, what are the key provisions which are there in this act. Then we'll look at what are the individual rights. We'll explore the act from the healthcare perspective, the implications of the act in healthcare industry. As I told you, we'll look at from doctors, patients, and healthcare IT person, IT technology, health IT technology perspectives, and from a hospital, what is happening and how it affects all of us. Then we look at some of the lacunas or what needs to improve in the existing one, though it is very good, but still there are some things which needs to be improved. We will look into all that. Why is this act needed? Why does it all this act needed? So if you see, you might have read in a lot of newspapers last year that there was a data breach in one of the major hospitals in India, and most of the data which was exposed to people, and it was even mentioned that it was sold somewhere and all those things. It's not only in India. You can see there's an article which came in Healthcare Data Breach Statistics in HIPAA Journal. Over the period of time, see the kind of number of healthcare data breaches which is happening. This is more than 500 plus records. If you see, so many number of 700 plus data breaches are happening every year. This is what the data is showing. Not only this, we also see there is misuse of personal health data by third party companies. Here we also saw some of the news articles where personal data of 3 crore people, this is from one of the news article I just took, which was on sale. We do not know what exactly has happened, but this is what was there in the headlines last year, if you can see in early last year. Now, with all these things are rights, the patient, there are a lot of consent issues which are linked to it altogether. That's why this act, the need for this act is even more important. Now, thanks to Government of India, they came up with this Digital Personal Data Protection Act 2023, which was enacted on 11th August 2023. This act provides the proceedings, processing of digital personal data in a manner that recognizes both the rights of the individuals to protect their personal data and the need to process such personal data for lawful purposes. This is what this act. Along with this act, we also have digital personal data protection rules. Now, this digital data protection rules actually provides a critical details and operational guidelines for implementing the act. This directly impacts various healthcare stakeholders, which includes the hospitals, it includes the diagnostic centers, pharmaceutical companies, patients, healthcare platforms, health IT companies, all of them. So this is what is about this act. We will just go into details of this act. Now, before we go details into it, because if we have to understand what is act, there are certain terminologies which are used in this, which we will be talking, which is it's more important to understand. One is a consent manager, who is a person who is registered with the board, and he is going to be the single, he or she is going to be the single point of contact for anybody. He will manage the entire consent process for any organization, for each organization. And data, we mean any representation of information, facts, or concepts, or opinion, or anything which is related to human beings. That is what we talk about data here. Data fiduciary is the means the person who alone or in conjunction with other person determine the purpose and the means of processing of personal data. Data principle is basically the individual. In healthcare context, it could be the patient, it could be a child, or it could be a disabled person who can be the guardian also. Or the data processor is a person who is going to process the data on behalf of the data fiduciary. And data protection officer is someone who has been appointed by the company, by the data fiduciary, to manage the process the data. The other four important is digital personal data. That is the digital data in the digital form. Personal data, anything which identifies the individual, that is personal data. Personal data breach means any unauthorized processing of personal data. It could be accidental or purposeful. You may get acquisition, share, use, alter, destruction, or loss of access to personal data. All these things relate to personal data breach. Processing here, in this processing, we are means it relates to a personal data where either it could be part or the whole, which is automated, or you are doing some kind of processing, which includes collection, recording, organization, structuring, storage, adapting, whatever you're trying to do, or even some kind of research, retrieval, data retrieval, dissemination of the data. All these things are related to processing. So now these terminologies are important for us to understand these act. Now, what does this act actually talks about? The key aspects of this act talks basically about the legislative framework. The act provides a really a comprehensive framework to protect our personal data in the digital environment. Okay. Now, it also gives us how to handle this data. It gives us the guidelines of handling the data. It gives a very clear guidelines for collection, storage, and processing of the personal data by an organization or by a data processor, whomever we are identifying. And this encourages the organization to adopt responsible practices in managing the personal data to the users, to protect users data. It is encouraging organization to use all the data security measures so that it is protected. It also talks about the privacy, the rights of the individual. The act aims to strengthen the individual privacy rights, giving the users or the data, whoever the data belongs to, more control over their own data. This is the in just what this act talks about. Let's now look at what are the main principles of this act. Uh, the first one, the most important one, is the consent. The act actually mandates that explicit consent should be obtained from individuals before collecting, processing, or sharing any kind of personal data. This consent must be informed, it should be specific and freely given by the person. Okay, it cannot be forced. Now, the second main principle this act depends on is the purpose limitation. Whenever somebody is collecting a personal data, the personal data should be collected and processed for a specific, clear, and lawful purpose only. Okay. Now the third one is data minimization. Whenever an organization or an individual collects someone's personal data, they should collect and process only those data that is necessary to achieve a specific purpose. That is what is data. Collect only minimum data what is required, and for that particular purpose only. Now, when you're collecting, we need to give utmost importance to the accuracy of the data. The data should be complete and up to date, because sometimes there are old data which keeps continuing, so data must be up to date. Okay, and the storage. Next is the storage limitation. Now, whenever most of the time we tend to store a huge amount of data, whenever we are collecting, that's what generally it is done. Now, personal data should be retained only as long as it is necessary for a specific purpose. You cannot keep on storing the data for years together. Okay, and there needs to be have a purpose, and you should only store for how many hour years there is legally it is permitted, or you have taken permission from the data principal, that is the owner of the data. Next one is the security. The organizations must implement measures to protect the personal data from unauthorized access, from data breaches, and misuse of the data. Here, it could be the individual who is collecting the data, or it could be organization. In healthcare context, it could be the hospitals, or it could be research organizations, or it could be some kind of diagnostic who's providing some diagnostic services. Anybody related to even healthcare IT companies who are collecting data. For example, there could be telehealth platforms who are collecting information from the patient and then storing it. So they need to take care that they take all the measures to protect the personal data from unauthorized access, breach, and misuse of the data. And accountability. Whoever is collecting the data, they are responsible for as per the act for the data. Organizations are responsible for demonstrating the compliance with the act. So these are the seven major principles I would put in a very summary, which this entire act is dependent on or based on this. Now let's look at from healthcare point of view, how what are the implications of this act. So today hospitals are very critical role play a critical role in managing large volumes of sensitive patient data, including medical records, treatment histories, and personal informations. So according to this act, there are several implications for the hospital. Though this, let me tell you, though this act does not specify anything related to healthcare, but it is a general act. But in general, we are trying to interpret it for the healthcare context. So the implications for the hospital is, the first one is the hospital should enhance their data protection policies. Hospital must implement a stringent data protection measures to safeguard the patient information, including their personal data, electronic health data, and everything. Okay, they should have a consent manager. The hospital should have collect an explicit consent from patients before collecting any kind of data and even sharing it with anybody. So this provides clear information about, when you collect this consent, the hospital should provide for what purpose the data is collected, how it is going to be used, and who is going to use. Everything must be clearly mentioned in that consent. Now, data security. We should, because with today's era of all the cyber security problems and all those things, the hospital should use the technology and protect the data from breaches, from unauthorized access. It could be, you maintain it in the form of encryption, access control, regular security audits, whatever security, data security measure needs to be done, the hospital needs to do it. The most important of all is compliance with the act. In that, data localization is one important thing. So according to this act, the act imposes restrictions on cross border transfer of data, so necessitating that the data whichever is stored, it should be stored and processed in India itself. It cannot be going out of India. Now let's look at what happens, what are the implications for the doctors. Most of the time, the doctors are directly collecting patients. Generally, that is how they interact with the patients and collect the personal information during the consultation. So, what are the impact of this act on the doctors? So, the doctors must ensure that the patient consent is obtained and documented very well before you collect any other information from the patient. And this includes how the data will be used. That's important. Patient consent is important. And the doctors also need to adopt data security measures. They should practice in handling this patient data. So it could be, you can use encrypted communication channels, secure, the storage of this data should be in a secured place, or whichever electronic health records are they are using, they should ensure that the data security practices are in place in that particular electronic health records. Then because most of the time doctors, we are least bothered about what is happening. So this act, it is always good that we need to be trained in this act to know what are our requirements, what is the role of the doctor, and to be compliant with the act, DPDP Act, what a doctor needs to be done. It's better to get trained. So this includes the training of how, what are the rights of the patients, and as a healthcare provider, what are your rights and what are your obligations towards the patient, towards the data, and towards the organization. Now let's look at from the healthcare IT companies perspective. Okay, so today health IT companies provide technology. They are providing solutions that facilitate data management, storage, analysis to the healthcare providers. Now, because all these things today we are dependent on the IT companies, the IT companies have certain responsibilities to protect the data. So the IT companies must implement robust data protection measures, secure the personal health information, and most importantly, the identifiable information from others. Okay. Again, we should comply with the data localization. It should be within the country. The data should be stored and processed within the country. There should not be any transfer of data outside India. Then transparency and concern manager. So again, so if you see, all the stakeholders who are involved, they have the similar responsibility in this particular act. So the transparency, the company must provide clear information about how the personal data will be used, how you are obtaining the data, and you should get it after the consent. Explicit consent must be obtained from each of us. Now, as a person whom the data belongs to in healthcare, it's basically the patient's data. What are the implications for the patient? So it is actually the act empowers patients or the data principal whom the data belongs to. So they have the greater control over their personal data. So every patient who have, they have the right of the data. So they have a right to access the data. They can request for any correction if they need any changes. They can ask for deletion also. So the act gives us right to access, view the medical record, or we can ask for whatever data we need, okay, from the data fiduciary who is collecting this information. And we also have the right to correction, where you can rectify any inaccurate health records, or if there is any change in our data, whatever is needed. And sometimes we also have the right to erase the data. Okay, you can delete certain data records after certain time period. And right to grievance redressal, then you can complain if there is any misuse of data. So there is a provision for all these things for the patients. The second is the informed consent. The patients can make informed decision about who collects the data, for what they are giving. If they want, they can say no, they don't have to give the data. So it is the informed consent. It is the patient's right to decide on giving the information, whatever is required. The patient can trust their data, which is handled securely and transparently, which is reducing the risk of misuse, because they get to know from the organization what are the data security measures, privacy measures, and how they are going to use. So now the patient can be assured that their data will be safe. So these are the implications from the healthcare point of view. Now let's look at some of the complications or challenges for healthcare organizations which will be there. Again, these are the four things which are common, which is coming up. That is obtaining the consent, explicit consent about the data, and protection policies. Report the data breaches. This is important. If there is any breach of data, promptly the healthcare organizations or the data fiduciary or any authority who is having the control over the data should inform the authorities, and also to the individuals whose data has been breached. Immediately they have to inform them as soon as they get to know. The act clearly mentions it about it. And the healthcare organization can appoint a data protection officer, who is a designate, who is qualified individual to oversee the compliance of these data protection act, the regulations. Okay, now we saw what this act is talking about. Now let's very quickly look about see what are the drawbacks or lacunae in this DPDP Act from a healthcare point of view. Though this DPDP Act is a very significant step towards protecting digital data, personal data, there are certain limitations and challenges, especially in the healthcare sector. Okay, the first one is the lack of specific provisions for health data protection. So, as I told you before, this particular act is a general act, unlike which is HIPAA or GDPR in HIPAA in USA or GDPR in European Union, which where they have a dedicated health data protection laws. But the DPDP Act does not explicitly differentiate health data from other personal data. Now, health data is more sensitive and it needs a stricter safeguards. But the acts, this particular act is treating all the personal data as equal. There are a lot of risks, especially for the hospitals and health tech companies, which may misinterpret the compliance requirement due to lack of clarity. So it is always good to have a separate act or separate guidelines for health related data. Now, as you saw, when I was taking when we were talking, there was over reliance on the consent. Now, without a stronger user awareness, today, as initially we told, we all have tick mark without even reading. We don't know. We have not seen read much in detail about what is this, and many people don't even understand what is the consent process. Patients just do not understand their rights. They do not understand the privacy policies. Patient often blindly trust the doctor, and they agree to all the terms and condition whatever is given, especially even in the any digital apps or healthcare apps. This is what is happening now. There could be a challenge for health tech companies and startup companies where there are innovations happening. The act is introducing a lot of strict regulation. It's good for data storage and transfer. But what happens is this may slow down the digital health innovations in India. So today we are dependent a lot on AI-driven healthcare solutions, and these healthcare solutions require large data sets. But this DPDP Act actually restricts access to these patient records. Okay, so there are some things which needs to be done, and there could also be possible that today there is nothing which is talking about either the government or a private data. Maybe in future things may happen that government may get exemptions from this provision for data security, reach, privacy. So when this happens, the huge amount of data, this is just an
Uh,
just
Dr. Umashankar, sorry
yeah.
for the interruption, but we are running short of time.
Yeah,
We have two more
I'm
sessions.
just
Yeah.
quickly going on to the last point here is about there is no strong enforcement mechanism for the data breaches, but there are huge penalties which are there, and there is limited protection for the digital health data in this. To conclude, I would like to say that this act is a step forward. We are moving towards patient-centered digital healthcare data, but the law alone doesn't is not enough. We need responsible implementation, and there is lack of specific provision for health data, and compliance challenges are there. Unless we take care of all these things, it would be difficult for us to proceed further. Thank you.
Thank you so much for that elaborative session. It was truly amazing to go through the whole structure of the Act. So, without any further delay, let me take this privilege in welcoming Dr. Dev Taneja, who is a general surgeon as well as he is an MBA who has done an healthcare management from NUS Business School, Singapore. His strong expertise is in hospital project management. He's been managing multiple corporate hospitals across the country and globally as well. He's been certified from Project Management Institute in the USA, and he's currently assistant professor at Department of Surgery in MGM Medical College. So his specialization in the healthcare management is focused on rapid process design and integrating that with the project management. Just fuel that with his PhD in healthcare IT. His one of his remarkable works, benchmark works, is on digital tech in hospital administration, a strategic choice, which was published in JAPI in October 2023. So, with this brief introduction, let me hand over to Dr. Dev, and just a heads up to the speakers, let's stick to the time limit. Thank you so much.
Thanks, Dr. Harsh, for introducing me. Can I have the slide, please? Aishwarya, are you handling the slides? So I'm touching on the healthcare perspective, clinical perspective of this, basically data security in healthcare challenges and best practices. Can we go to the third slide, please? Yeah. So I am now basically concerned with the clinical perspective. Dr. Umashankar has given a brief about basically DPDP, which was passed in August 2012, but it has still not been rolled out. And then there is another legislation which, for a draft of which was circulated in March 2018, which is known as DISHA, or Digital Information Security in Healthcare Act, basically. So these are the issues or the elephant in the room. Now, why all these data protection laws have come into the healthcare? Earlier, also, we never revealed the history of the patient to anyone. So, doctors were always protective about their patient's history, and they didn't divulge it to anyone else, basically. So, the history is basically Institute of Medicine in USA in 1999 came out with a report to Earth is Human, in which it was seen that 44,000 patient had died because of medical negligence in America. This shook the whole world, and later on your JCI accreditation and follow-up accreditation in other countries was made compulsory, and EHR was introduced to improve coordination of care, improve clinical quality, clinical decision support systems, research, etc. Now, HIPAA, I'm sorry for the misspelling, it is HIPAA. HIPAA Act was passed in America, which was basically concerned with the healthcare. Initially, did not move at a faster pace, but after the IOM report, everything was Haitian. So it is basically deals with personal health information. It has issues regarding the privacy of the patient in individual identifiable information, its security, and complication of breaching those security. Uh, why? What is so important about HIPAA? HIPAA is there to standardize healthcare transactions. It allows you or it mandates only to use certified EHR, and then security is administrative, physical, and technical. Violation and penalties of this particular act lead to civil and criminal uh, outcomes for the care providers and clinical establishment and health information exchanges basically. And then parallelly, when all this was related, so a lot of thing was becoming digital. So health information technology economic and clinical health act was also passed in 2009, which was passed to promote use of health IT, population health management, meaningful, and it had a meaningful use, which I will come in the subsequent slide. What does that mean? It provided incentives for adoption of EHRs, and EHR requirement had specific core and menu requirements, and there were violations and penalties. So this is the background, like how healthcare data protection came into the healthcare basically. Next slide, please. Aishwarya, next slide. So now we come back to Disha, which is basically Digital Information Security in Healthcare Act, which has been draft is already in circulation since 2008, but Act has not come up. So it deals with the personally identifiable information like name, address, date of birth, telephone number, email, financial information, physical, physiological, mental health condition, sexual orientation, biometric, vehicle number, and government ID. But it does not disallow direct sharing of identifiable data between two hospitals. Next, please. So, Digital Information Security and Health Act. So, there are certain definitions. So, few of them the Dr. Umashankar has presented. So, anonymization basically that whole data whenever it is shared to the so there should be anonymization of this data or de-identification. A consent need to be taken. You cannot collect the information without consent. Breach has its implication. You have to de-identify the data when in certain instances uh, it is concerned with only the digital health data, not the paper records basically. So whatever paper record, if they are digital, then only it is used. Various entities have been described. The guardian, in case the patient is unable to give a consent, then guardians are allowed in case if the patient is a child or if he has certain other disability. And there is a health information exchange. Basically it is related to the claim management of the medical clinical establishment under our laws. Owner means a person whose health data is created. Personally identifiable information I've already described. There has to be certain prescribed rules by state and central government. Relative is all related family members or lineal descendant. In America, laws are little different. There has to be data security, sensitive health related information. This I'll come. This is more important for doctors and clinical establishment. Serious breach as per section 38 of the act, and specified as specified, there will be a national e-health authority at national and state level, and need to know basis. Any person who's handling this data have to carry out lawful use or purpose for which that whole data is getting collected. Next, please. So I now from the historical perspective, I am coming to HIPAA. So basically, it was intended for standardizing the healthcare transactions, and it requiring all health plans to engage in healthcare transaction in a standardized way. They are now required to use standardized HIPAA electronic transaction, and thereby it had come out with HIPAA electronic transaction standard like HL7, FHIR, and there are other standard for healthcare softwares and hardwares as approved by the HIPAA. And then there are electronic data interchange or health information for healthcare claim billing information. Next. Every institution or a healthcare provider will have a national provider in identifier. An institution can have a multiple NPI for in case they have multiple facility or subcenter within their facility. Next, please. The difference between the civil and criminal penalties are summarized in the following table. So doctors should be very understand ki what are the type of violation may happen from their end or the clinical assessment. So basically, some inadvertently some negligence is done, and people not have known about it. Second is reasonable cause and not due to willful neglect. Then there will be due to willful neglect, but violation is corrected. And fourth is willful neglect and the violation is not corrected. Next. Uh, and criminal was basically knowingly obtain or disclose individually identifiable health information, or with the when offenses are committed with the intent for commercial advantage, personal gain, or malicious harm. Next.
So just a heads up, we have 1 more minute to go. Thank you.
uh, I'll need some time. 5 minutes basically. So these are the various types of HIPAA violations which occurs mostly because of the data is stolen, or it is unauthorizedly data is disclosed without authorization from the patient, or data loss not accounted for 12%. So these are the major reasons. Next. This is Health Information Technology for Economic and Clinic Act. So why all these act are getting? There has to be some reason or objective for having this. So this had come basically to promote and expand the adoption of health information technology. The most important piece of healthcare legislation to be passed in last 20 to 30 years for the foundation of healthcare reforms, and it has to be used for population health management. Next. So it is basically for improving healthcare quality, safety, and efficiency. So now they have defined it should not be adoption, but there has to be meaningful use of electronic health records basically. And that US government has provided incentive for healthcare institution and doctors to use certified EHR basically, and they have given financial incentive. And doctors who do not have adopted EHR will be penalized. Next. Next, please. So, what do you mean by the meaningful use? Basically, so it means improve care coordination, reduce healthcare disparity, engage patient and their families, and improve population and public health, and ensure adequate privacy and security. And only a certified EHR technology need to be used. Next, Aishwarya. Next. So these are the meaningful. So core requirement. What that EHR should have. Next. And what are the menu requirements. So all this EHR has to have this minimum requirement in them. Next. So health, because of HIPAA, there are ongoing concern among clinicians and researchers in USA. So physicians are mostly worried about the financial cost of implementing it, the risk of disobeying it, and the nuisance of new paper that it would create. And confused healthcare provider remain worried about breaking the law inadvertently. This Privacy Act also has implication on the medical research, particularly prospective and longitudinal research, which has led to 73 decrease in patient accruals for doing research. Next. Clinician unclear on information policy. The physician and their staff sometimes do not know when and whom they can legally distribute patient information, uncertain about their privacy responsibility, and often respond with an overly guarded approach to disclose information. And it focuses more on extensive training, focus heavily on compliance, and the fines and penalties for the violation may be one cause. Next, no, previous slide. Previous slide. So most important is basically doctor is worried about their employees or business associates. Business associates people performing on action on the doctor's behalf, like insurance agent, billing agent, consultant, transcriptionist, etc. Sometimes, if the transcriptionist or their associate discloses this information without proper authorization, then doctors won't be held responsible, but they have to terminate the contract in case they have, and they have to report the problem also. Physicians should remain vigilant about the breaches of patient privacy by providing employee training, safeguarding, and distributing patient information in appropriate ways. Next, please. Now I'm touching DPD Act only from the healthcare perspective, basically. So if you are using a telemedicine app, you have access to the mobile phone of the patient, basically, or computer, but you are only using for personal data for availing telemedicine, and not you're accessing their contact list, etc. And basically, if they
Sir,
right,
yeah, sir, we'll have to give a break here. We're just on the verge of ending the session. Yes,
uh, a
I'm sorry
minute,
for the time
uh,
lapse. Yeah,
a
yeah.
minute,
Thank you.
a minute.
Yes.
Last slide. I'm going to the last slide. Last slide. Uh, yeah. So key takeaway for Monday: health data security rules are inevitable. In present form, DPDP and draft DISA Act provision lack strategic objective and supporting frameworks. When using software for EHR apps, telemedicine, etc., offer HIPAA compliant or FDA certified software as far as possible. Indian health IT software and hardware standards are work in progress. Prevention is better than cure. PCP&D Act has taught medicos lessons in consent taking, maintaining register, and timely reporting to the Public Health Authority. Use the same logic here. HIPAA and HITECH Acts led to evidence-based medical care, proper documentation, and reduction in medical errors. Don't fear, but be vigilant. In India, many legislative acts are poorly drafted, lack coherence, leading to ambiguity in regulation and implementation, and leaving various stakeholders at the mercy of the law enforcers. Thank you.
Thank you so much, Dr. Dave, for those amazing elaborative session. So with this, we enter the last lap. We enter the one yet another amazing session from Professor Supten. Professor Supten is an MBBS and he holds a PhD in multiple, along with that, distinguished fellowships from FIA, HSI. He's a former FIMER fellow. He's a distinction fellow at HitLab. He's also a renowned TED speaker, and currently he's chairing the LITD 35, which is a sectional committee on active assisted living with BIS India. He's a co-chair to Task Force on AI in Healthcare at National Academy of Medical Sciences India, and he's also an advisor to School of Digital Health at IIHMR University, which is in Jaipur, along with Malareddy Vishwavidyapeetham here in Hyderabad. So with this, he has held multiple international roles as governor, board of governors in Commonwealth University of College of Medicine, St. Lucia, and also in SNOMED CT e-learning group. So with this humble introduction, let me take the privilege of welcoming Dr. Suptain. Over to you, sir.
Thank you, Dr. Harsh, and thanks to the organizers for giving me this opportunity. Of course, we don't have much of a time, but then I'll try to uh, go through the slides quickly and talk only about the important things which haven't been covered by the earlier speakers. Uh, I think digital health, if you know, in fact, there was a division of digital health in WHO. I mean, it started as late as 2019. And one of the first things that they did is to have a global strategy on digital health. And digital health is defined as the field of knowledge and practice associated with the development and use of digital technologies to improve health. Rather simple definition. but actually it's a very wide spectrum umbrella. I'll just clarify a few terms which are commonly used, misused, abused. Digitization is basically analog to digital conversion. Digitalization is the process of using digital data to simplify the work processes, the organization culture. But what we are actually aiming at is digital transformation. And that is a complex, multifaceted, and disruptive way of changing the way business gets done. Of course, it has to be centered on public health needs. And obviously, AI has got a big role to play in this. So, now the question to my topic, I mean, how can digital health really improve safety? So, when we are talking about healthcare safety or patient safety, that's a very crucial aspect. So, if we use the electronic health records, what are the advantages? Healthcare providers are able to access details of patient health status, and obviously, chances of medical errors are reduced. Another aspect which is very commonly discussed in a forum like this is the clinical decision support system, or the CDSS. That's a decision support tool that can help doctors and other healthcare providers choose the right treatment plan. It provides the alerts or suggests recommendations about the possible drug use or consuming a particular food allergy and multiple sorts of problems. Now, there have been lots of articles on this. In fact, in about 4 years back, this one came out, Digital Safety. That's the next frontier for patient safety. So, when we are talking about patient safety, safe hospitals, smart hospitals, green hospitals, digital safety assumes a very essential part of it. We have been working on this. In fact, we have had some publications. Dr. Umashankar talked about responsible innovation. In fact, this paper, and there was a follow up paper we had brought out about 4 5 years back. When we talk about responsible innovation in the AI age, we have to always keep in mind the beneficence. I mean, do no harm. That's the basic thing which even Hippocratic Oath speaks of. Security is a very important aspect. Social justice we cannot, in fact, overlook. In fact, most of the biases which we see in either large clinical trials or in the large language models, the chat GPTs and so on, the bias is often because of the lack of social justice. So these are all interrelated and intertwined. There has been a lot of works going on for the past few years related to digital health interventions. How can they enhance the prevention in primary care? And it's the digital that's the key word here. In fact, this is a slightly dated paper from JAMA, and this came out in 2018, so almost 7 years back. That was a Project Hope. So there, what they have done, they had used an EHR-based real-time analytics program for patient safety surveillance and improvement, and the results were quite promising. In fact, a lot of follow-up activities are also being done. Uh, there are a few references, and I'd love to share my presentation. You can share with the audience or whoever is interested. And anything I say here, all the references are cited here. You can go to the links, and most of them are open access articles. You can download the whole article and read at your leisure. So the main issues of patient privacy are two. One is the concerns with the access, use, and control, and the second, of course, is the problem of re-identification. So, what are the perspectives when we talk about this patient trust in the age of AI? How do we maintain and build the confidence? How do we navigate the regulations of patient privacy? In fact, both Dr. Umashankar and Dr. Dev did touch upon such bills. In fact, one of the bills, Disha, which was drafted in 2018, and I was personally involved with the drafting as well, because that time I was working in the Ministry of Health, and we had drafted it along with the National Law School in the University of Bangalore. But ultimately, it was withdrawn in favor of the what is now the DPDP Act. So in 2019, in the Parliament question, it was answered, and I've shared the link both in the WhatsApp group as well as in the chat box. You can just look at the news item. So Disha is no more relevant because it has been formally withdrawn. But DPDP Act is important. I'll come back on it because there was a question about it from the audience regarding its compliance. Challenges in safeguarding patient confidentiality with AI. Where are the problems? We all know about the cyber attacks, illegal access, and breaches, and so on. In fact, this Ames ransomware was a very well known case and which has revamped a lot of security issues. But the weakest link is the human. More than 88% of the cases, it's the human who's responsible for any breach in security in any of the health systems. There might be also algorithm biases while dealing with patient information affecting the fairness of the output. Then moral conundrums. Should we bear the possible advantage of artificial intelligence against patient privacy protection? And of course, patients are concerned about the usage of the data. Even if a law is passed by the parliament, assented by the president, it may be challenged for the constitutional validity. So there have been some ethical guidelines. Both came out in 2023. One was from the Indian Council of Medical Research. Another was from the National Academy of Medical Sciences. I was co-chair of that task force. And we did bring out a lot of guidelines. The ICMR talks about the diagnostic, screening, therapeutics, drug discovery, development, clinical care, epidemiology, prevention, behavioral mental health care, and for all the parts. And of course, how do you really use for healthcare and research for all the procedures? In the NAMS, we looked at the challenges: lack of data, inadequate infrastructure and connectivity, lack of regulation governance, lack of shortage of skilled personnel, adequate timely funding and investment may not be available, ethical and societal concerns. We recommended some short term, medium term, and long term measures. What's been the regulatory progress? The third edition of our national health policy came out in 2017, which had proposed the setting of the National Digital Health Authority, which was drafted through the Disha Bill, which was placed in public domain in March 2018, but it was finally withdrawn. Another relevant act here is the Medical Devices Rule 2017, which again I was actively involved with, and their software as medical device has been included. In the 2020 amendments, also, they're very much there. Then, as I said, when the Disha bill was withdrawn, the PDP 2019 bill was introduced. Then the COVID came. Then there was joint parliamentary committee which suggested more than 60 modifications. Then the data protection 2021 bill was placed, but then finally it was replaced with what is now the Digital Personal Data Protection Act 2023, which Dr. Umashankar beautifully explained. This is the Gazette India, and these are available. The final this National Digital Health Blueprint as well as the Digital Personal Data Protection Act are available in the public domain. I won't talk about the act, it's been already covered very well. But one caveat, and that's related to the question that was asked, that is about compliance. So, the Ministry of Electronics and Information Technology, or the MIT, had published the draft Digital Personal Data Protection Rules 25 on its website on 3rd of January this year for public consultation. They had extended the date from initially from 18 February to 5th March. The feedback and comments were invited from all the stakeholders, and many of us, including Dr. Taneja, had made the feedback and we have sent it to them. So let's hope that some of them are included so that the compliance becomes realistic and possible. I'll also respond to some of the questions which the moderator had kindly shared earlier, and I'll give the full reference to it. So, how can AI developers and doctors ensure ethical AI implementation? Obviously, AI, as I talked about, should be transparent, fair, bias free. We can also look at explainable AI or XAI. Here's an evidence. This full journal article I have given. This came out in the Nature Group's Japan Journal of Radiology in 2024, and the study shows that black box AI models can introduce biases leading to misdiagnosis, especially in the minority groups. The second question from Dr. Hirsch was, why is explainable AI or XAI critical in healthcare? Again, I've added a reference here. This is an excellent paper from Yang, came out in the Journal of Healthcare Informatics Research in 2022. So, what happens? XAI makes AI driven diagnosis interpretable and accountable. It's emerging. By explaining the prediction outcomes, XAI gains the trust of the clinicians as they may learn how to apply the predictive modeling in practical situations instead of blindly following the predictions. But there are still many scenarios to explore how to make XAI effective in clinical settings due to complexity of the medical knowledge. The third question from Dr. Hirsch was related to AI models in healthcare have shown biases in diagnosing certain population, how to address this. Again, unbalanced training data, that's the important thing. So obviously we need diverse data sets, bias audits, fairness testing. So this study was on AI dermatology, and this came out in the Lancet Digital Health 2023. So they found that 40% less accurate for darker skin tones due to bias training data. This was the result of this Lancet study, which came out in 2023. And there are various follow-up studies also. There are various other relevant articles. I have given the links to three of them. Closing remarks, as Dr. Harsh would have liked to say. So, actually, ethical AI adoption requires transparency and fairness to avoid bias and privacy risks. So, thank you. That's the end of my presentation. Thank you very much.
Thank you so much, Dr. Supten. That was amazing. I think this was a very unique lineup of exchange of ideas, right from the act aspect on what are the legalities, where are we in 2025, what's that reference point we could be looking at to understand more on the legal aspect of adoption of technology, AI, or in fact digital health per se. And then that was followed by a lot of amazing inputs, the clinical inputs, which are very much relevant for us as practitioners from Dr. Dev, and the closing, the finishing stroke was by Dr. Supten sir on a larger perspective of not just looking at the act and the clinical applicability, but looking at a larger blend of consequences around not just the AI on the legal front, but looking at digital health as an entire spectrum, and also the journey, how beautifully sir covered right from the Medical Devices Act to the way it transformed to DSHA, and then finally we how the 2021 draft led to the 2023 Act, which we are now following. So I think this summarizes the evening, and it was truly an amazing learning experience. So I would like to end this with a positive quote. We always say life is all about learn, unlearn, and relearn. No better way than to close the session with this remark by having such amazing set of speakers. On behalf of Doctors AI team, we are extremely grateful for your time with us today and for the amazing knowledge sharing what just happened today. Over to Dr. Aishwarya. Thank you so much.
Thank you so much, because we are already running short of time. There are a few audience questions, so we'll just take one or two and end the session if you allow, sir. So there is one question which says, "What proactive measures should the hospitals take to protect the patient data from cyber threats?" This is a question for Dr. Supteen.
Yeah, as I said, it's the people part which is the most important thing. So we have to actually make the people measures. We have to take certain factors for the organization, the workflow. In fact, what happens? I mean, even in the AIMS case, that was it's always the weakest link is the human. We don't care sharing our passwords. We don't mind if anyone can access our accounts. That's something where I mean most of the problems occur. And then, of course, there are various other issues. And as far as the practical part, as I had said for the DPDP Act, let's wait for the rules to come because there have been lots of issues regarding the rules. Lots of comments have gone in, and they will definitely look at most of them, what they measure. There might be countermeasures, and as I said, it may ultimately go to the Supreme Court because constitutional validity might be questioned. Because right to privacy again is paramount, but right to life is also paramount. You can't balance the two when you are thinking. I mean, whether you protect too much of data as right to privacy, but then that may cause death. So right to life is gone. So that's a very delicate issue, and I think we definitely need more deliberations on this.
Yeah, and
Definitely.
I like to add, there is no basically objective defined in any of this act ki why they want, and there are no facilitating framework being introduced or incentives being introduced for a medical fraternity, clinical establishment to adopt all these things basically, and it will create a lot of confusion basically down the line.
Yeah, definitely. There is one more interesting question which says, "How far are we from creating our own data sets, the Indian data sets, for making our own GPTs and stuff?"
Well, that would require a separate session, rather, right?
Definitely.
Because we are there now. We are there. Just that we need to have more updation on the regulatory boards to help us better. Yeah,
The other aspect is
absolutely.
we do have a lot of analog records. We certainly do have our population is the highest, but in digital, in a proper standards compliant form, where we can actually retrieve and analyze, that sort of data is have to be, I mean, created.
The biggest challenge in India is basically one, we use algorithm and AI, so none of the clinical specialty national level have their own clinical defined guidelines for practicing their specialty or clinical protocols. And number two, whatever data is being coming up in the AHR, it is not a computable clinical data. So we have a huge healthcare data, but it cannot be converted into a basically meaningful, actionable information because of how we are using this technology. Some sense has to come. how to use health informatics to our advantage, basically. And AI is uh, in that direction
AI
also.
is just a tool. I mean, AI is nothing more than a tool.
Yeah, yeah, it is basically,
Just like
yeah,
stethoscope is a tool, AI is also a tool. I mean,
and
it's
outcome is
nothing
as
more,
good as
nothing less.
the quality of the data set we will be creating.
Yeah.
Absolutely, yeah. Absolutely. So I think we are at that kind of juncture where, like how today's session, it stimulated a lot of thought processes. But then if these thought processes get funneled into a single, directive or rather communication, and open more doors of effective communication like what we had today, I think the future is really bright. And yes, I think we are entering into a new ushered era of very futuristic change in the healthcare, in the way we have been learning healthcare to the way we've been practicing, and now what we're going to practice in the future. So yeah.
There is this one budding doctor in the chat, I guess, who is asking that how can you explain to a patient's relatives that the data in the EHR will be safe? So they are asking for, I think, some tricks from you. Any tricks, Dr. Umashankar sir?
Be honest, that would be the best trick. Tell them that your EHR is safe, protected, and all the data is encrypted, and you follow all the data security measures and privacy measures. That's the best way to explain them, and nothing can be better than being honest with them. That's all.
Definitely. Uh, Thank you. Thank you so much, everyone on the panel, and thank you, Dr. Harsh, for moderating such a wonderful session. Um, Thank you, and from all the Doctors AI team, I'd like to conclude this session.
Yeah.
Thank you.
Thanks,
Thank you.
thanks, thanks
Thank you
for
so
having a
much.
wonderful
Thank you.
day.